The hour of 9 o'clock having arrived, we will call the House Health and Welfare Committee to order. First order of business is roll call. The secretary has taken a silent roll. We do have a quorum present, and so we are ready for business. First item on the agenda is rules, and I will turn this over to my vice chair. That he's handling all the rules. The secretary has said, "Oh, I'm surprised you took your laptop along." I told her I just want to look at something besides rules. So with that, I will turn it over to the vice chair.
Thank you, Mr. Chairman. Yeah, the rules, 4 days in a row. We get 9 days of this, so it's going to be a little bit of reading. And anyway, we'll go to the first item on the agenda, which is docket 160309-2301. Mr. William Deseron, come on up to the podium. Please state your name and affiliation, and the podium's yours.
Good morning. My name is William Deseron with the Department of Health and Welfare. Thank you for the opportunity to speak today. I'm a program manager for the Division of Medicaid and Policy and Innovation. I come before you to present docket number 16-0309-2301 on Medicaid Basic Plan Benefits. That begins on page number 489 in your pending rules book. The Medicaid Basic Plan provides preventive medical, dental, and vision benefits for participants who meet income standards. I request you approve these pending rules as final. These rule changes decrease regulatory burdens, make technical corrections, remove language related to the end of the public health emergency, and return to standard operations, and align with the Idaho Behavioral Health Plan, which are with our Medicaid state plan. Changes also align this chapter with the latest changes to Idaho statutes and rules from the 2023 legislative session. Primarily, this includes House Bill 153 regarding bridge year physicians, House Bill 223 regarding the Medical Consent and Natural Death Act, House Bill 374 regarding criminal abortions, and Senate Bill 1094 regarding international medical graduates. We also updated because of changes in IDAPA 160506, criminal history and background checks. There is no anticipated fiscal impact to the state general fund or any other funds. The department conducted 2 public hearings for this rule. We received no comments. These rule changes align with legislative changes and changes to the Idaho Behavioral Health Plan, for which the legislature approved appropriations. Additionally, these rules remove allowances under the public health emergency that were necessary for the circumstances providers were facing, as well as burdensome administrative processes for occupational and physical therapists and speech-language pathologists, and requirements for providers in other states to follow Idaho statute for their license. If these rules are not passed, they will not be in alignment with legislation, cause confusion among providers, retain outdated terms and restrictive requirements, and restrict the services we can provide under the Idaho Behavioral Health Plan. Language was simplified to reduce word count with no changes to meaning. I am happy to review those rule changes one by one or go through the substantive changes. I request you approve this pending rule as final. Mr. Vice Chair, Mr. Chairman, members of the committee, that concludes my presentation. Thank you for your time. I stand for questions.
Thank you, Mr. Deseron. Committee, if you haven't read the behavioral health plan for the state, you probably should review that at some point. It's really different from what you've seen in the past. So if you have time, if you would do that, just most of you don't have a lot of time, I know that, but any comments for Mr. Deseron? Questions? Seeing none, we'll take a motion if they have one to approve this or disapprove. Go ahead, Representative Redmond.
Thank you, Mr. Chairman, for a motion.
Motion's in order.
I move that we adopt docket 16-0309-2301.
Motion's on the table to approve docket 16-0309-2301. Any discussion on the motion? All those in favor signify by saying aye. Aye. Any opposed? Same say by nay. Motion carries. Thank you so much. Up next on the agenda, docket 160310-2101. Again, Mr. Deseron, thank you so much. The podium's yours.
Thank you, Vice Chair and members of the community for the opportunity to come before you today. Again, my name is William Deseron. I'm a program manager for the Department of Health and Welfare's Division of Medicaid, Policy and Innovation. I come before you to present docket number 16-0310-2101 on Medicaid Enhanced Plan benefits that begins on page number 528 in your pending rules review book. The Medicaid Enhanced Plan includes the basic plan benefits, as well as services for long-term disability, developmental disability, and those with special health needs, such as participants requiring an organ transplant. I request that you approve this pending rule as final. These rule changes decrease regulatory burdens, make technical corrections, remove language related to the end of the public health emergency and return to standard operations, meet requirements of the KW settlement agreement, allow parents and spouses to provide personal care services, limit the number of residents in residential habilitation, adjust the number of hours allowed for developmental disability services, align rule with necessary developmental disability waiver operations, require background checks for non-medical transportation, and align with changes to IDAPA 160506 criminal history and background checks. There is no anticipated fiscal impact to the state general fund or any other funds. The department conducted 2 public hearings for this rule. We received 1 comment, which was related to home delivered meals. We did not pursue changes due to concerns that Idaho businesses would face additional competition from businesses in other states. These rule changes align with changes to the KW settlement agreement. Additionally, these rules allow parents and spouses to provide personal care services and update DD waiver service limitations and operations for participant safety, provider convenience, and program requirements. If these rules are not passed, there will be confusion among providers, retention of outdated terms and restrictive requirements, and be out of compliance with the KW settlement agreement. Language was simplified to reduce word count with no changes to meaning. I'm happy to review those rule changes one by one or go through the substantive changes. I request you approve this pending rule as final. Mr. Vice Chair, Mr. Chairman, members of the committee, that concludes my presentation. Thank you for your time. I stand for questions.
Thank you. Any questions from committee members? Representative Gallagher?
Mr. Chair, and I'm sorry,
Mr. Deseron.
Deseron.
Deseron. In, let's see, section 009 on page 532, under 2K, the non-medical transportation providers. Can you just explain to me what that is? What the definition, what is the non-medical transportation provider?
So
Mr. Deseron.
my apologies. Mr. Chairman, Representative Gallagher, non-medical transportation providers transport participants for things outside of medical appointments. This is related to waiver participants who have additional services. They may need transportation to a job site where they're doing supported employment. They may need transportation to the store to buy groceries. They're typically not able to support themselves in such a manner.
Mr. Chairman, follow up. So who is the driver in this instant?
Mr. Deseron.
Mr. Chairman, Representative Gallagher, typically the driver is a caregiver, someone either employed by an agency. It may also be a family member who's being paid for that service.
Another follow-up.
Mr. Chairman, last follow up. So this wouldn't apply to an Uber or a Lyft.
Mr. Deseron.
Mr. Chairman, Representative Gallagher, no, it would not apply to them.
Okay.
Thank you. Representative Redmond? You have a question still?
I don't for a motion. Oh, looks like. With
Motion's in order, though, and then we'll.
I'm gonna
let him
withdraw.
comment. Oh, Representative Van Water.
Thank you, Mr. Chairman and Mr. Deseron. Yesterday, we heard issues about background checks, about being kind of on border and it wouldn't give you approved until like October of next year or this year. This also has background checks. Does it have the same issue as far as health and welfare and background checks that we heard in foster care? In that type of rules, does this have that same issue as far as health and welfare and background checks?
Mr. Deseron.
Mr. Chairman, the health and welfare background check is the background check that they would have to go through. I'm unsure if they're having the same delay. I did used to work in the background check unit. I can tell you that foster care background checks have a little bit more pieces to them, such as checking the child protection registry in other states. So that may be the cause, but I cannot say for sure.
Thank you.
I was wondering, for the edification of the committee, if I'm not sure a lot of people have ever had to like work through getting a basic Medicaid person to the enhanced and do the paperwork and the things. Now, can you explain just real quick the difference between those two and the process that they go through? Is that something you can explain?
Mr. Chairman, no, I wouldn't be able to explain that process. It's handled by a different division in the Department of Health and Welfare.
And I just think that's an important thing to understand. If you're on this committee, there's a big difference between the basic Medicaid plan and enhanced, and sometimes it's just getting them to that level. But I've had to do it in the past, so it's sometimes a burden, but it's worth it. And certain patients need that, so they just get on a different plan. And she could speak to it if you'd like. Yeah, go ahead. Appreciate that. Come on up.
Good morning, Mr. Chairman, Vice Chair, and committee members. Juliette Sharon. I'm the Medicaid Administrator with the Department of Health and Welfare. And to answer your question, Vice Chair, so the basic Medicaid plan serves individuals in Medicaid. So it serves pregnant women, children, our expansion population, but it is kind of our, as referred to, basic kind of general benefits through Medicaid for physical health. Individuals served on the enhanced plan are individuals with intellectual and developmental disabilities and higher level of need. And as Mr. Deseron referred to the benefit around non-medical transportation, we have different services that support individuals to live in their community, reside in a home setting in their community. And so there's additional services. We refer to that as the waiver. It's a home and community-based services waiver. And I think that's what the Vice Chair was referring to, is once you become Medicaid eligible, you can then apply for the waiver and go through a separate process based on functional eligibility for those additional services.
Thank you.
If I may also answer the chairman's question on the background checks, I think Mr. Deseron referred to it correctly in that the background checks for providers are different than those within the foster care program. And so I do not believe we have the same challenges that were noted yesterday. Thank you.
Again, Representative Redmond.
Edmund?
Oh, he has one more question for you. Mr. Roll.
Thank you, Mr. Chairman. Thank you, Administrator. So my understanding was it had to do with the FBI background check. And so I'm curious if the providers go through that same FBI background check or if they go a different route.
Mr. Roll.
Mr. Chairman, Vice Chairman, Representative Redmond, there is a background check for any criminal history. We also do, as part of provider enrollment, we also look at any providers who may have been excluded from any sort of federal program. So it could be Medicare and Medicaid or any other federal programs due to a criminal history. So the FBI could be involved in those situations, but is to look for overall criminal history.
Thank you.
Oh, and you're going to speak to it.
We're going to bring up the whole group today. Come on.
Background checks are a popular topic this week. Mr. Chairman, members of the committee, I'm Maren Unsworth, and I'm a Deputy Director at the Idaho Department of Health and Welfare. The provisions discussed yesterday in the foster care licensing rules were very specific to what we call a Code X purpose background check. So it allows an immediate background check utilizing the FBI to do an immediate placement for a child. So we have a relative, we have an auntie, mom's best friend who wants to be immediate placement. It allows for that immediate placement. The individual then must go through the more traditional background check, that's the fingerprint background check that other applicants go through. So it's very specific to the foster care licensing rules and foster care placement to allow for that immediate placement. And as the committee heard yesterday, the FBI has asked the state to put the requirements of those provisions within our rule by February of 2024 to come into compliance with the Code X purpose background check, if that helps clarify.
Thank you. I think Chairman Vanderwaal has a question.
Just another question again on background checks. Thank you, Mr. Chairman. And When we hire Optimum or somebody else and they hire people, does the state do background checks on who their providers are? Or is the provider supposed to do background checks on who they're using? If Optimum or Magellan or whoever is out there doing a contract, who is responsible for the background checks of the next level of service that goes out?
Thank you, Mr. Chairman. Great question. I'm going to look over my shoulder here. I know they require background checks. I believe the provider utilizes
Correct.
the state background check system.
I can answer that as a provider. I mean, I've been doing those background checks for over 20 plus years in Idaho. every year, every 2 years, you go in, you get fingerprinted.
I'd like to see all his background checks.
One year I went in last year, because I was like, I work with children, right? So last year I went in there, I'm like, wow, I've been getting background checks in Idaho since 2002 or something. That was kind of funny to look 20 plus years back. So yeah, thank you.
Thank you.
Representative Redmond.
Sorry, one more question.
Oh.
Sorry,
Follow up.
I had my notes. Thank you, Mr. Chairman. I had October. Is it February or October that we need to be in compliance?
Go ahead.
Chairman, Representative Redmond, sorry if I said February, I meant, yes, October is accurate. Sorry,
you.
I misspoke there. It is October. I wanted to give us more time.
There you go. We had to have a lively discussion today. We just think rules are so just real quick, but sometimes it's entertaining. So, all right. Any further discussion on this topic or questions? Representative Redmond.
For a motion?
Motion's in order.
Thank you, Mr. Chairman. I move that we approve docket 1603102101.
Motion's on the table to approve docket 160310-2101. Is there any discussion on the motion? Seeing none, all in favor signify by saying aye. Aye. Chairman votes aye. Motion carries, it passes. Up next on the agenda is docket 160313-2101. Welcome back, Mr. Deseron.
Good morning again. I come before you to present docket number 160313-2101 on consumer-directed services. That begins on page number 585 in your pending rules review book. Consumer-directed services assign a budget to participants with developmental disabilities and allow them to direct their own care. I request that you approve this pending rule as final. These rule changes decrease regulatory burdens and make technical corrections, remove language related to the end of the public health emergency and return to standard operations, and align with federal regulations around conflict of interest. There is no anticipated fiscal impact to the general state fund or any other funds. The department conducted 2 public hearings for this rule. We received no comments. The rule changes align with federal regulations around conflict of interest. Additionally, rule references to the public health emergency were removed. If these rules are not passed, they will not align with federal requirements on conflict of interest. Language was simplified to reduce word count with no changes to meaning. I'm happy to review those rule changes one by one or go through substantive changes. I request that you approve the pending rule as final. Mr. Chairman, members of the committee, that concludes my presentation. I stand for your questions.
Thank you. Committee, any questions on this docket? Seeing none, motion would be in order. Representative Roberts.
Thank you, Mr. Vice Chairman. I move that we approve docket number 16-0313-2101.
Thank you. Motion's in order, motion on the table to approve docket 160313-2101, Consumer Directed Services. Any discussion on the motion? Seeing none, all in favor signify by saying aye. Aye. Any opposed, same sign. Seeing none, docket's approved. Up next on the agenda, docket 160318-2301, Medicaid cost sharing. Again, Mr. Deseron, the podium's yours.
Mr. Chairman and members of the committee, I'm here today to present docket number 16-0318-2301, which can be found on page 593 of your pending rules review book. These rules cover cost sharing such as copays and premiums. The department asks the committee to approve these pending rules as final. We developed this rulemaking in compliance with Executive Order number 2020-01, Zero-Based Regulation, which implemented the process for all state agencies to rewrite their respective chapters by DAPA every 5 years to prevent outdated regulations and reduce regulatory burden. The rules in this chapter have been rewritten to meet those requirements. Additionally, these changes improve, and simplify language for this chapter and cover specific details for the State Children's Health Insurance Program, known as CHIP. Home and community-based programs subject to cost sharing include home care for certain disabled children, which is the Katie Beckett program, youth empowerment services, or YES, and workers with disabilities. There is no anticipated fiscal impact to the state general fund or any other funds. The department sought both informal and formal input from the public on this rulemaking. This included 2 negotiated rulemaking sessions hosted on May 10th, 2023, and a public hearing on October 12th, 2023. During these comment opportunities, the department received 1 comment from stakeholders, and that consisted of a recommendation to determine if the language could be reduced further in accordance with Idaho code and federal law. In summary, these rule changes clarify and simplify the cost-sharing rules for Medicaid. If these rules are not passed, they will continue to have unnecessary regulatory burdens and extraneous language. Language was simplified to reduce word count with no changes to meaning. I'm happy to review those rule changes one by one or go through the substantive changes. I request that you approve these pending rules as final. Mr. Chairman, members of the committee, that concludes my presentation. Thank you for your time, and I stand for your questions.
Thank you. Looks like we have a question for Chairman Vanderwall.
Thank you, Mr. Chairman and Mr. Cerrone. Several of these determine household income. How is that verified? Is it self-verification? What is in the department when they're looking at cost share? How do they determine whether the household income figure that they're getting is correct?
Mr. Deseron.
If I could yield to Jennifer.
Throw a
Pinkerton.
lifeline out, sure.
Thank you.
Feel free to come up. Just state your name for the record, if you would.
Jennifer Pinkerton. I am a policy analyst in the Division of Medicaid for Department of Health and Welfare, Chairman,
Thank you.
Vice Chair, and members of the committee. The way that our premiums and all of those income brackets factor are based on the eligibility that is done in the Department of or Self-Reliance when they do the eligibility, and they send that information over to Medicaid so we can assess the premiums. So it's verified through interfaces with the Social Security Administration, with the Department of Labor, with E-Verify, and they also do paper or verifications with employers like pay stubs and things like that to verify all the income that people have.
Follow up.
Follow up.
Do you use the tax commission at all on what they
They
file on Idaho
do
taxes?
have an, oh, sorry,
Yeah, go ahead.
Chair. They do have a interface with the tax included in their software interface with the federal government.
All right, thank you.
Another follow-up? Oh. Would, if you could, for the edification of the committee, can you explain the difference, or one of you, I'm sure, could figure this, but the difference between, I mean, because some people don't work in the Medicaid space on a regular basis. So the Katie Beckett program with the adults and the higher income versus the Yes Medicaid and the CHIP, is a quick overview of the various programs that are within this docket here.
Vice Chair and members of committee, yeah, those are 4 separate eligibility groups, and they all have different, some have different programs that are available to them based on those groups. Katie Beckett is a program for families that traditionally do not become eligible for a Medicaid program, even with a disabled or high-need child. It's a higher income limit, and it has that's why there's a premium. It has a higher level of need to be on that program also, but it's typically folks that have children either that need intensive medical services in order to stay in the home, and skilled nursing to go with that. The YES program is similar in that structure with the higher income brackets typically, and then it also extends more behavioral health plan benefits. Somebody else may want to clarify some of that, but that's not one of my SME areas. And then the Medicaid Workers with Disabilities, that is a program that is targeted to folks who qualify for Social Security disability due to typically a physical disability, and they're still able to work. They usually have higher income and also end up in a situation where they can't qualify for Medicaid, but they have a higher level of need for medical needs. And the program allows them to access services if they meet that level of care and stay there working, like at various degrees of, you can look at that income scale and see how high it goes. But depending on that scale, they may no longer get Social Security benefits, so their income is down farther. So that would have normally helped bridge some of that difference. But it adjusts so they can continue to work while getting the care they need. The other group was
Chip.
CHIP. Somebody else want to speak to CHIP? It's just a children's program. I can't really answer that question.
Hi, good morning, committee. Juliet Sharon, Medicaid Administrator again. The Children's Health Insurance Program, or CHIP, is a program that does just that. It provides children's health insurance coverage, but it is for families up to a higher level of household income. So it can be a little bit above what is allowed for within Medicaid alone. But it provides the same benefit package as a child on Medicaid would receive. And as Jennifer explained, we do have premiums for that program as well, given the higher income that those families do have.
Thank you. So if committee, just in general, like if you ever worked with families with really extreme cases, and you can just picture you're a working class family, you do really well with your income, but then you have this really extreme need for your child with disabilities. That's where these programs come into play, so they don't bankrupt you as a person to where you're not able to even work. And so it's a really good safety net for that. And I get to interact with folks who utilize that, all four of these very often. So it's just sometimes really helpful to know what they are just a little bit. So thanks for taking care of that for me. Representative Vanderwall, you had a question as well?
Yeah, just another follow-up question kind of on that as you, thank you, Mr. Vice Chair. As you evaluate, and I know we do determination on Medicaid once, and it has to be done annually. But what if a family has, let's say they're doing a certain percentage of copay based on their income and their income drops? Are they allowed to get that reevaluated immediately for their copays, or do they have to wait until the annual? In other words, how often can that be adjusted during that time frame?
Mr. Deseron.
And it goes both ways, in my opinion. If their income goes up, do they have to report it? Or if their income goes down, can they report it and receive a smaller amount of copay?
Mr. Deseron.
Mr. Chair, Mr. Vanderwald. Yes, the participant can request redetermination at any time. They can submit new documents to have their premiums or copays adjusted. If their income lowers, then they might wind up with no copays or premiums because they're in a new eligibility group. They can also request it if their income goes up. I don't believe that there's a requirement to do so until their annual redetermination, though. There is one.
Okay, and follow-up?
Follow-up.
Thank you, Mr. Chairman and Mr. If there is a change, does that count as another redetermination and move it down to, because it's annual? So if there's a redetermination in the middle of, say you're 6 months in, your income changes, you get a redetermination, does that move that redetermination back out to another year from that time? Or is it annual from when they sign up?
Mr. Deseron, or you can use your lifeline.
Committee, Mr. Chairman, Juliet Sharon, Medicaid Administrator. I would have to follow up with our Division of Self-Reliance that completes all of the redetermination work. I believe, but I will double check and get back to the committee. I believe that it is based on that date. So if there was a change in income 6 months in, they would redetermine, are they still Medicaid eligible? Yes or no? If they are still, then it starts again from that date forward. I will also just note that the premiums in the Medicaid program are based on those different programs and income. Our copays currently in the Medicaid program are set at $3.65 for every applicable service. We are evaluating some potential changes to cost sharing in the future, and I anticipate we'll be bringing those changes forward next legislative session, as we have not updated that $3.65 in quite some time. So I just wanted to note which part is more income-based and which is just a flat amount today.
That was good information. Thank you so much. Representative Dixon?
Thanks, Mr. Chairman. And the question might be for Ms. Sharon. I'm just wondering, with children that are covered with CHIP, if the family misses a premium, do they lose their coverage? What happens? Do they have a grace period?
Ms. Sharon?
Vice Chair, Representative Dixon, yes, we do provide a grace period. There are also, exemptions for hardships that families are going through. We cannot remove someone from CHIP or Medicaid for failure to pay a premium or a copay. That's in federal regulation.
Thank you. Any further questions? Seeing none, motion would be in order. Representative Dixon?
For a motion?
Her first.
I would move that we approve docket 16-0318-2301.
Motion to approve is on the table for docket 160318-2301. Any discussion on the motion? Seeing none, all in favor signify by saying aye. Any opposed, signify by saying nay. Seeing none, motion carries. That was the last agenda item on there. I'll turn the podium back over to, or the gavel back over to the Chairman Vanderwater.
Thank you, Mr. Vice Chair, for taking care of that. We'll have a meeting tomorrow. I'm hoping we have an RS to introduce tomorrow, but depending on Representative Redmond to actually get his act together and provide me with the RS. So we will have some more rule review tomorrow. Tomorrow I do have a panel I'm on for broadband at 10 o'clock. So if the Vice Chair gets done at the same time tomorrow, I'll be here the whole time, but I might get up and leave tomorrow on that. I find it interesting, and just to comment on, I think it's the first time I've heard it today. Well, if you don't pass these rules, you're really going to be in trouble, or, we can't operate. I don't know if that was, intentionally put into the presentations, but I find it interesting that, maybe because we held a rule yesterday, they decided to tell us that if you don't pass these rules, we can't operate. And it's true, you need the rules, but I think we're all well aware of that. And that's why we review them. So with that, committee, I don't have anything else for today. And with that, we are adjourned.